Medicare can feel like a giant puzzle with tons of pieces and no picture on the box. Sound familiar? Well, you're not alone. In this video, we'll cover everything, including what is Medicare and who's eligible, the differences between traditional Medicare and modern Medicare Advantage plans, when do you manage your Medicare each year, how to avoid costly mistakes, and important changes for 2025. So let's take the confusion out of Medicare and put you back in control of your health care. Ready? Let's go. Hi, I'm Keith Knabb. Affordable Medicare Solutions is my agency, and my team has been helping people for 30 years to navigate the ins and outs of Medicare with confidence. So Medicare has been around a long time. It's been around since 1965, and the problem was that seniors did not have health care coverage at retirement. So the government created Medicare and also at the same time created a program called Medicaid. Well, Medicare is for regular seniors, whereas Medicaid is for the low-income or poor indigent seniors. You can have Medicare with Medicaid. You can have Medicare alongside veterans benefits, and you can have Medicare alongside your group health insurance plan if you're still working. But you cannot have Medicare alongside the Affordable Care Act personal health plans. So who's eligible for this Medicare program? Well, when the government first designed Medicare, it was for people who were turning 65, and they expected them to have a few years on Medicare. Well, you and I know that's much changed. People are living a lot longer today. But that was the original intent of the program. And then some people raised their hands and said, well, wait a minute. You know, Bob got hurt at the factory. He's only 52 years old. What about Bob? Then they created Social Security disability income to give Bob money to put a roof over his head, keep food on the table. And they said if he's disabled for 2 years, we're going to let him have Medicare early. So that's a huge amount of people now, almost 10 million people getting Medicare early. And the third type of eligibility is where people raise their hand and said, well, wait a minute, this person's not going to live 2 years. They've got kidney failure or they've got Lou Gehrig's disease. They need their Medicare faster. So now people can get their Medicare as early as 4 months into their disability. So how was Medicare built? Well, the original intent of Medicare was that it was going to focus on hospital coverage. Part A of Medicare is the hospital coverage because in the 1960s, almost everything was done at the hospital. You needed testing, you needed other treatments, you needed to have exploratory surgery. That was all done at the hospital. Well, the outpatient portion of Medicare, called Part B, is today the most important part. That's where all of your outpatient surgeries, new hips, new knees, are outpatient and not inpatient. So Part B of Medicare has a cost, $185 per month per person, and that can be higher if you're a high income earner. So Part B of Medicare covers outpatient, Part A is your inpatient coverage. So in 2005, Medicare decided to modernize. After doing the same thing from 1965 till 2005, they realized we needed to modernize Medicare and make it more friendly for seniors and more comprehensive. So that means there's two ways to access Medicare: the traditional classic way that they left alone, or the new modern side of Medicare called Medicare Advantage. Now this is important. Medicare has done this modernization now for 2 decades, and we're going to have even more efforts over the next 10 years. So this is a gentle modernization, and you get to decide which way you access your Medicare. The traditional side of Medicare that was created in the 1960s had problems. People started complaining right away that Medicare did not cover everything, and insurance companies love to hear people complain about little issues that they can design an insurance policy to cover and sell to you. So they created things called Medicare supplements, which are also called now Medigap plans, to fill in the holes of Medicare. And these plans are very, very effective, but they made a mistake. I already had told you that Medicare has Part A for hospital coverage and Part B for outpatient. Well, in the wisdom of the government, they decided to standardize all of these new miniature insurance policies called supplements with letter codes. So they made Medicare more confusing. Somebody would say, well, wait a minute, this insurance agent's trying to sell me a B supplement, but I already have Part B. They should have used something else like Roman numerals, but they didn't. And now there's another part of Medicare that you have to add called Part D, which is your drug coverage. So you have a 3-card system. You have Part A and B card, which is your red, white, and blue Medicare card. You have your supplement card, and now you have your drug card. No other health plan in America makes you carry around 3 different cards to access your full coverage. In 2005, when the government designed these new programs, they invited the insurance companies in and they said, we will design plans that are based on the group health insurance model that people have enjoyed at their jobs for decades. And so they've designed these Medicare Advantage programs to be a single ID card, just like at your job, and you'll have either an HMO plan or a PPO plan. HMO means a mandatory network that you have to use unless there's an emergency, and a PPO plan means an optional network where you can go in-network or you can go out-of-network, maybe pay a little bit more money, but have more access to doctors nationwide. These programs are delivered by the private insurance companies, and you still always have to make your Medicare premium payment of $185 per month. But it is very convenient that everything comes in one package. At this point, a lot of seniors say to me, Keith, just tell me what most people do. Well, to be honest, it's now split down the middle. We've seen this in our practice for about 10 years, that 50% of seniors are taking traditional Medicare, and it's fantastic. And 50% of seniors are now signing up for the Medicare Advantage programs. It really is a personal choice, and neither one of these options are going away, but they do change year by year. So here are the 3 key areas that you have to look at when you're trying to decide between traditional Medicare with a supplement or an Advantage program. What doctors can you see? How much is this plan going to cost you out of your pocket each month? What is it going to cost you when you get sick to get better? So it's very important that you understand under traditional Medicare, you can go to any provider nationwide that takes Medicare. That's going to be a lot in most hospitals nationwide except Medicare. You can go to Georgia, California, New York, and your coverage won't change. If you like what you've heard so far, give us a call at Affordable Medicare Solutions. We'll make this stress-free and easy for you. Now, you have to generally add a Medicare supplement to make sure that you have complete Medicare coverage when you're using traditional Medicare. So there's an expense to that. It might be $200 a month in your area, and you would have to add also drug coverage, which national average on that is $38 per month. Now, the nice thing about paying that money each month is that you've prepaid for your health care, because when you go into the hospital, you're going to have 100% coverage. On an outpatient basis, each year you might have a small deductible of $257. So those plans are very effective, and we call that prepaying for your health care. Well, let's contrast that to the Medicare Advantage programs, which are tremendous and they're very good, but it's the opposite. It's where you pay as you need care. So let's talk about it again. What doctors can you use? You have to first look at your network of doctors. If you choose a PPO plan, we call that an open access network. Generally, you're going to have national coverage on a PPO Medicare Advantage program. HMO is a mandatory network, much more localized. Now, almost all of the Medicare Advantage plans, around 80% now, are zero premium. Even on a national average, the ones that have a premium, it's not more than $17 a month. Well, that's a very low monthly cost for you. And that cost, though, means that when you do go to the hospital or you go to the doctor or have outpatient surgery, you're going to pay co-pays. So instead of prepaying, when you get sick at the emergency room, you might pay $100. It might be a $10,000 emergency room visit, but you paid $100. Doctors might be free on primary care, might be $40 to the specialist. Hospitals, where it starts to get more expensive, you might pay $300, $400, or $500 a day for the first 4 to 7 days at the hospital. After that, it's free. And you're going to have a maximum out-of-pocket per year. And those maximum out-of-pockets have been escalating. They used to be around $5,000 to $6,000. Now some are as high as $9,300. So be very careful about your out-of-pocket maximum exposure. So what about the extra coverage in Medicare Advantage? Well, there are tremendous benefits, and we have a bonus video you should watch at the end of this video called Modern Innovations. It covers all the details on free dental, hearing, vision, groceries, and other benefits that are incredible under the Medicare Advantage programs. Now, before you get excited about any plan, be aware that every year in around November, we get the star ratings, which means they're quality ratings for the plans. 1 to 2 stars is bad, 3 to 4 stars, and 4.5 is common. Very rarely do we have 5-star Medicare plans. Now, these star ratings apply to the drug programs and the Advantage plans. Medicare supplements are rated as insurance policies, and you want to get an A or A+ rated Medicare supplement. In 2005, Medicare finally decided to cover prescription drugs for seniors. It's crazy, we did not have coverage until then. Well, there's been a lot of changes, and we have a bonus video that you can watch that explains all of them. But here's a couple of tidbits. Medicare has a maximum out-of-pocket in 2025 for your drugs at $2,000 spending for you for covered drugs at a covered pharmacy. That's out of your pocket, very low risk. Those plans can change every year, and the premiums you need to watch out for can be as low as $0 per month in Georgia up to about $150 per month. So watch our bonus video for more information. Remember, our team is available to you at no charge to help you with your Medicare planning. So here's an example of how we help people manage their Medicare. I know this is a lot of information, and when you manage your Medicare, it's called enrollment periods. And I don't want you to become an expert on this because we are the experts. But we'll tell you, everybody has the ability at age 65 to use their initial enrollment period, which means you're turning 65. And you can do that 3 months before your birthday, you can do it your birthday month, or 3 months after. The government makes it flexible. You go to Social Security's website and sign up for Medicare Part A and Part B. Now, some people don't need to sign up at 65 because they're still working. And maybe they work till age 68 and then they call me and say, hey Keith, I'm losing my employment insurance. That's fine. They rely on us. We say you've got a special election period, which means we're going to be able to use that loss of your group health insurance to be able to help you activate your Medicare plans immediately without any gap in coverage. Now, at the end of every year, people forget, and we remind our clients, you have your annual period called the annual election to manage and make sure you're on the right plan. If you got a notice that your plan is ending, we're going to find you a new plan. So every year that starts October 1st on a preview. October 15th is when we can actually enroll people into new plans. Now that period ends on a strange date. It ends on December 7th. And the reason they did that is so that you'll get your ID cards before January 1st. We used to work to the end of the year and people wouldn't get their ID cards till January or maybe even February 1st. Crazy. Now, there's a new period that the government created because some seniors were still not doing their annual reviews, quite a few to be honest, and the annual period was missed. So they can now use January or February or March, the first quarter of the year, to say, hey Keith, we forgot to do our annual review and I'm on an HMO or a PPO Advantage plan and my doctor's not covered or my drug's not covered. I've got a problem. We can fix it during January, February, and March and either get them a new Advantage plan or help you to go onto original Medicare with a new drug plan. Just rely on Affordable Medicare Solutions to decode all of these enrollment periods. And if a person has got low income or is chronically ill, we've got even more flexibility for them. Sometimes people make mistakes and they screw up. It happens a lot. People try to take care of this Medicare themselves and they create themselves a financial penalty headache that is with them the rest of their life. Some examples are people using COBRA, which is group health insurance continuation after you leave a job. Well, don't do that if you're eligible for Medicare. Maybe your spouse or dependent children need the COBRA, but if you're eligible for Medicare, go straight in. Otherwise, you might create penalties. And if you ever screw up signing up for outpatient Medicare Part B or Part D, which is drugs, that's a lifetime penalty. And under Part B, it's very severe. It's 10% per year. So that's, maybe $18.50 a month for the rest of your life, whereas Part D might end up being about $4 or $5 per month the rest of your life. That's a headache that we will help you avoid. Low-income people don't pay penalties. And high-income people, unfortunately, also pay expanded premiums under Medicare. And we have a video at our YouTube channel about how to avoid that high-income penalty. So how do you sign up for Medicare? You do it through the Social Security website, ssa.gov. And you want to do it online. That's the best way to do it because Social Security is not allowing a lot of people to come into the offices anymore. You want to do this 90 days out from your birthday or from the date you plan to retire from your job. Now, it takes the government about 30 days to process your request at least, and also then a paper card comes in the mail. Well, you're going to get a lot of junk mail before you turn 65, and people throw away a lot of junk mail. Well, sometimes they accidentally throw away their Medicare card. Don't do that. Make sure you get your paper Medicare card that the government sends you. Now, that's important, but if you're over 65 and still working, it's a whole different process. You have to get a form from your employer called a verification form that they sign and say you're losing your group health insurance, and you'll need to upload that form to Social Security for your Medicare. Very important. So what are your next steps? Remember, this is a process. Give yourself 3 months out to apply for your Medicare. That'll give you a couple of months to do some shopping. You call Affordable Medicare Solutions. We'll show you all the plans that cover your drugs, your doctors, your hospital, and your pharmacy. We'll take care of all of that for you so that when your retirement date or your birthday comes around, you're set. There is no gap in your coverage. Now, even though you may have signed up this year, you still need to do a review in October. Starting October 15th, we can do reviews. So call our office and we'll make sure you're good for the upcoming year. It's a process every year. Just put it on your calendar. All right, so what did we learn today? We learned that there's 2 ways to access Medicare, either traditional, effective, classic Medicare, or the new modern Medicare Advantage programs that have lots of extra benefits. Remember, half of seniors at age 65 are choosing traditional, and the other half are choosing the new modern Medicare plans. Your decision is not permanent. There are rules. We help you manage moving between those 2 systems upon your request. Medicare doesn't cover everything. We have a bonus video that does show you all the things that Medicare does not cover. And we want to make sure that you understand you should review your plans every fall, October 15th to December 7th. People that are either low income or have chronic illnesses, so Medicare and Medicaid clients or people that have chronic illnesses get special ways to manage their Medicare and extra benefits also. So we need to hear from those clients and let us know if they've received Medicaid. Affordable Medicare Solutions wants to help you manage your Medicare. Remember, Medicare is not set it and forget it. There's so much we can do for you each year to make sure your Medicare journey is pleasant. For example, we can help resolve problems with any authorizations. We can help assist clients with any drug issues or understanding on how their new drug benefits work. We always help prevent scams. Clients call us with fears and we help take care of their questions. We review their annual notices, which tells them that their plan is having changes. We help people find new plans as their needs change or their plans change. Adult children love our staff. There's no charge to work with us. We decode Medicare for them. If you got a 55-year-old daughter taking care of a 75-year-old mother, it is a big relief for them. We help explain plans and benefits, oftentimes to dentists and doctors' office staff who are confused. We help people access their free extras like dental, vision, groceries, and other benefits. We do continuous education and updates to our clients every year through our YouTube channel, through email, and through social media. We help navigate as hospitals and doctors sometimes get in fights with Medicare. We want to make sure that you're covered, and we make sure that we will iron out those problems when we can. We give you free support from a client services team at no charge to you year-round. A big question we get at Affordable Medicare Solutions is, how in the world are your services free to me? How is there no charge? Well, the government decided to help all of these consumers by funding each plan enough to pay for certified and trained Medicare advisors to help you. That's what we are. We're certified and trained Medicare advisors. This means that the plans pay for the service charges on your behalf. There is no extra fee for using a compliant and trustworthy local service like Affordable Medicare Solutions. We are proud that we help thousands of seniors annually, and we don't have any charges to the seniors or their families for helping them understand and use Medicare. Love to help you with your Medicare. Please give us a call at Affordable Medicare Solutions.